So today I'm going to deal about gastrointestinal disorder. So normally, what are the it will be started mouth to harness for all the disease. I will be start. Okay. So if your first four process means injection. So it will take in mouth, then digestion, then intestinal absorption, then injection of anus. So injection means taking food, digestion means breaking down the food into the nutrients, then absorption, taking the nutrients by cells. Injection means removing any leftover wastes. So for oral health concession, so here jerd will be there. So here for taste, dental sensitivity related to the hot or cold stimulate, the dental erosions and pulpitis, the dental thermal sensitivity is the generally due to erosion of the enamel of the gastric acid. So here erosion will happen to the stomach. So here irreversible of pulpal now damage if there means that root canal therapy they can give. So dental management. So here fluoride they can use application of the using costume made occlusion train and order to the dental mineralizations and reduction of the thermal sensitivities. So dentist can restore the tooth structure and gastric acid to provide the comfort and minimize the further hard tissue damages. Here first started to oral. So here medical therapy they can do for dental management, gut. Then here general patient taking to any tagment or H2 receptor antagonist, it will be toxic reaction to the lidocaine. So they can use lidocaine for the to numbness of the teeth. So here esophageal structure fibros can complicate to the intubation of the patients. Then erythema and mucus atrophy. So normally we can that mucus atrophy will be there. So it's chronic exposure mean that smoking patient and all it will be face. So mild sodium bicarbonate rinse may be used for the stomatitis of the present. More spicy and smoke alcohol that patient and all will get. Okay. So hiatal hernia. Hiatal hernia means esophagus through the diaphragmatic hiatus into the stomach. It's just inferior to the diaphragm. The hiatus can causes anatomic narrowing the opening to the stomach, then helps to prevent reflux of the stomach content to esophagus. So patient are weakened or enlarged hiatus. The purpose due to the hereditary factor will be there. It's caused by obesity and exercising and weightlifting. So when weakened, enlarged to the hiatus the portion of the stomach into the chest cavity. So enlarged hole, it's called for hiatal hernia. Then symptoms. So chest pain, which is may radiate to the patents similar those myocardial infection patients. Then infants with a hiatal hernia usually regret blood stain. Food make also difficult to breathing or swallowing. Adult patient may experience to chronic acid reflux into the esophagus. Then chronic esophageal infection may to the reduce the scarring and resulting to the esophageal narrow. So it's cause for dysphagia and heartburn they will have. Then types of hiatal hernia. So yes, sliding type and fixed hernia. So it's a sliding type is most common. So it's a herniation, it's a cardiac and gastric esophageal junction. It will be happen. Then fixed hernia. It's characterized by the upward herniation of the gastric fundus. So cardia and gastroesophagus is a normal places. So that complicated type is the most serious and least common from the hiatal hernia. So it includes a variety of herniation patterns of the stomach, include those enter to the stomach to move the chest. Okay, so her oral health consideration means they can give the dry mouth means exostomatia It's a zero somatia means dry mouth. It's alter patient physician. The various treatment of modalities of dry mouth. So artificial saliva, alcohol-free mouthwash, and increased fluid intake they can advise. So it reflects to the oral cavity is a present. Then disease of the lower digestive tract. So duodenal ulcer is normally will happen to the staying for some PG students. Okay, so duodenal ulcer responds to the mucus into the submucus. It's a deeper. So it's a necrotic tissue. It's considered the pus and fibrin. So that image you can see the ulcer. It's adjustment of blood vessels, their hemorrhage. So it continues to the serous outer layer to the duodenum and adjustment of organ to the perforation into the peritoneal cavity occurs. So here ulcer heals means granulation of the tissue and new epithelium. Only that upper skin layer they can erosion it will happen. So it's a prolonged period means it's associated to the demotive will be there. Okay, so symptom epigastric pain will be there. So it's epigastric, it's a pulling pain like this will be there. It's pursued to the burning sensation usually when stomach is empty or enough to meal in that sensation will be there. So duodenal ulcer is a gastric also aggregate to the food. Then bloating and abdominal fullness. So hematitis means blood vomiting will be there. Blood loss can lead to the iron deficiency anemia, duodenal perforation, which it leads to acute peritonitis and melena. It will be happen. So normally we can start to the oral. So oral means what are the dental management means if you have presence of epigastric pain, so the dentist should be referred to the person to the physician or diagnostic workshop. Then the dentist avoid administrating of the drug to ulceration, then distress to the aspirin. So it will be lead to it's happened to hematohematitis now, so they will avoid for aspirin and all. So antacids and content for calcium, magnesium, aluminum salts begin the antibiotic erythromycin they can give. So it's one or it's maybe it's a 1 or 3 days they can follow you. Then after 1 hour that antacid therapy they can give. Then erythromycin and tetracycline should be given to the 2 hours once after injection to the antacids. So it's a exogenous steroid administration and all. They can increase production of acid and steroid should be avoided. Okay. Then signs and symptoms. So here hallmark ulcerative colitis means rectal bleeding will be there and sometimes diarrhea will be there. So diarrhea is severe means more than 8 bowel movements into the 24 hours means they will keep for observation. So pain the both abdominal quadrants and scrumpy. It's for bowel movement. Erythema no erythema and all it will be red swollen nodules. It's usual to the thigh leg and maybe will be present for signs and symptoms. Then good prescription penicillin and penicillin B or penicillin G they can give. Hyposalivation means exoratomia. It's a common will be there. Anticholinergic there they can give. So wear complete or partial denture they can use. Denture adhesive they can use. Then clemipin and ranitidine drug commonly used prescription for ulcer patients. So antibiotic and all they can antibiotic and antifungal because dental management is not clear they can give. Then inflammatory bowel disease. So inflammatory bowel disease means it's a large intestine. It's a get ulcerative for or conditions they can get. It's called for inflammatory bowel disease. So inflammatory bowel disease for autoimmune disorder. It's a attack to the digestive systems. Then here join the symptoms occur to the patient's ankles and knees and wrist. So anemia commonly here present will be there. Then eyes are ulcerative and corneal ulcer they will then radiatitis will be there and photophobia they will be there. Ulcerative colitis means ulcerative colitis is a part of large intestine. So the mucus granula appearance disease mild. It will be present. Then sloughing, ulceration and bleeding and all it's normal. Then colon of the rectum they will colitis will be there. Then epithelial lining of the cut. Okay, mucosa only epithelial lining and all cut will be there. It's called corn disease. It's full thickness of the bowel wall. Then oral health consideration. So oral health consideration is the non-specific unman. It will be see the aphthous stomatitis and pyoderma gangrenosus, then pystomatitis vertigans, then hairy leukoplakia, it will be there. So oral manifestation of the anemia, patient have ulcerative colitis. It's a poor control disease. It will the pallor angular chestis and colitis they will be there. Then that images. Then corn disease. Corn disease is a inflammatory disease. It's a small or large intestine. It will be happen. So here cut epithelial cut cell they will have cutting. So it's a affect to the part of gastrointestinal tract to the mouth to anus. Then characterizes distribution of the intestinal ulcer. It's a skip lesion interrupt to the normal appearing mucus. Then recent epidemiologic evidence subject to the two corn disease. So non-performing and performing aggressive disease. So non-performing means recover slowly, and performing or aggressive it's more rapidly it will be happen. So uh, here fistula or an abscess they will be involved to the anus. So here stenotic obstruction it will be happen. Then what are the complication means it's a intestinal coma and systemic complication. Intestinal means structure and fistula, perforation, abscess, neoplasma will be there. Systemic means arthritis, ankylosing spondylitis, uveitis, and axial stone, and erythema, rhodosome, and pyoderma gangriones will be there. So corn disease means here that corn disease. So you can see large intestine it will be inflamed will be that is the corn disease. So it will be made to the fistula or abscess and all will be there. Complication, the systemic complication here they're showing. Okay, for what are the liver, biliary tract, joints, everything it will be affected. So another manifestation means corn disease. So corn disease is a recurrent or persistent area it will be happen. Then abdominal cramps will be there, anorexia, weight loss, unexplained fever, and malaria will be there. So corn disease of the patient is intestinal disease. It's a disease activity that recurrent epithelial cells is more common oral manifestation of the corn disease. So here pystomatitis, then gobblesteins, mucus, that second one. Second one is a gobblesteins, mucus architecture, then minor salivary gland duct pathology, and respirant of granulomatous changes to the constitute hallmark of corn disease. So corn disease patient developing to the diffuse and swelling of the lips and face. So here inflammatory of hyperplasia of the oral mucosa will be there. That bacteria or fungal infection with the dental caries it will be carrier to the whole patient immunosystems. Then what are the laboratory disease? Again, CBC they will do hematocrit level, then hemoglobin level, platelet count, coagulation study, PTINR they can do. Then liver function test, blood glucose and all they will check routinely. So if symptomatics means palliative sodium bicarb they can give. Okay, 1/2 teaspoon packing of soda, 8 ounces of the mixed with they can give. So moderate potential topical steroid they can give for fluconamide and desometazone and trioaminolone. They can use. Okay, then ointment they can use. It's a lesion of disseminated oropharyngeal distribution. Dexamethasone they can give. So this is for the normal gastrointestinal disorder. So kindly go through all the general. You can see the hospital site. You can go through and write it.